Good. Okay. My name is Raven Peterson. I'm going to be the provider for my patient today. I walked in and I washed my hands, and I'm just going to talk to him about performing an abdominal assessment. And to start, I'm just going to ask my patient for consent to do this video and to turn it in for assignment for school. Do I have your consent to do this video?
You do.
Wonderful. Okay, so with an abdominal assessment, the first thing we're going to do is just have the patient lift their shirt up, and he already has his shirt lifted. And the order of the assessment goes inspection, auscultation, percussion, and then palpation. So what I'm doing with inspection is I'm just looking at the abdomen, looking at the contour, looking at the color, noticing there's no discoloration of the abdomen, meaning there's no signs of jaundice. Also looking at the contour, making sure there's no lumps, bumps, bruises, making sure, trying to see if there's any peristalsis in the abdomen, and also looking at the aorta and seeing if there's any palpitations there. And with him, you can't see any palpitations around the abdominal aorta, which is good, and you can see some light peristalsis in the stomach, and then you can also notice his breathing, which is symmetrical. So after inspection, we're going to move on to auscultation, and with auscultation, we want to listen to the 4 quadrants in the abdomen, noting that there is bowel activity about every 5 to 15 seconds in each quadrant, and then also listening to the aorta, the renal arteries, the iliac arteries, and the femoral arteries. So I'm going to start with listening to all 4 quadrants with the drum. And he has good bowel sounds in all 4 quadrants. Next, we're going to move on to the aorta, and we're going to listen to the aorta with the bell and the drum. And what we're listening for here is just any turbulent sounds in the aorta. And then also same with the renal arteries, we're going to listen with the drum and the bell. So with both. And the aorta breaks off into the iliac arteries, and then also the femoral arteries. Wonderful. So after auscultation, we'll move on to percussion. And with percussion, we will percuss in all 4 quadrants. And with percussion, you should hear tympanic sounds. It's a large cavity there, and so you shouldn't notice any dullness. So with percussion, just tapping on the distal part of my middle finger with my dominant hand being the tapping hand. Wonderful, and that's tympanic all throughout all 4 quadrants. Next, we're going to percuss for the spleen and the liver. So spleen, we'll start. Liver. We're going to start with mid-clavicular line, about around the umbilicus, and we're just going to percuss until it's dull. So this is my first sign of dullness, and we're going to come up to up the rib cage, and then we're going to percuss in between the intercostal. We're going to percuss in the intercostal spaces. If you percuss on the ribs, you're going to hear dullness. And so I'm noting the liver span approximately here to here, which is in normal range between 4 to 7 centimeters. And then moving over to the left side for the spleen, we're going to percuss also, and it's going to be anterior axillary, mid-anterior axillary. And with the spleen, it's not uncommon to not hear dullness. I'm going to have him take a big deep breath in. Wonderful. I'm going to do this over here. Okay, great. And so that's the percussion of the abdomen. And last, we're going to do palpation. And so I'm going to start with just the light palpation, just to get the patient used to the feel, so not too surprised for the deeper palpations. Again, just palpating in all 4 quadrants. And on the deep palpations, on the right side, I'm going to be palpating for the liver. On the left side, palpating for the spleen. So what I'm going to have him do is take a big deep breath in when I'm palpating for the liver. So take a deep breath in for me. Just doing a deep palpation. Is there any pain when I do that?
No.
So no pain when I'm palpating for the liver. And you kind of go under the rib cage. Take a big deep breath in. And I'm just feeling for any mass that I can feel on my fingers. And on the spleen, I'm going to do the same thing, have him take a big deep breath in, go under the rib cage. And with the spleen, I shouldn't be noticing, normally I won't be feeling the spleen, and I didn't, so that's normal, and meaning he doesn't have any enlargement of the spleen. And also in the liver, palpating across. Great, just looking for any enlargement, hepatic enlargement. So that concludes the palpation aspect of the abdominal assessment. What I'm going to do next is a couple tests to check for cholecystitis. So what I'm going to do here is I'm going to have him take a big deep breath in, and I'm going to do that same deep palpation. And I'm going to ask him, do you feel any pain when I do that? No pain when I do that, so that's a negative sign for cholecystitis. That's the Murphy's test. So a negative Murphy's test. Next, what I'm going to do is I'm going to check for rebound tenderness. This lower right quadrant here, where the appendix is located, what I'm going to do is I'm going to do a deep palpation. And when I let go, I'm going to ask if they felt any pain when I did that. Did you feel any pain?
No.
Good. And so if there's more pain when I let go of that deep palpation, that is rebound tenderness, which is a sign for appendicitis. And on this left side, this is just where the colon area, when I do the deep palpation over here, that can sometimes be tender, but it shouldn't be sore. Shouldn't cause any pain. Next, what I'm going to do is I'm going to do a wave test, and I'm checking for ascites. And I'm just looking at the abdomen. I notice he likely doesn't have any fluid buildup in the abdomen, but I'm going to still check. And to do this test, you can have the patient or somebody around the office put their hand midline right here. My brother is a quad, so he can't put his hand right here for me. But what I'm going to do is demonstrate that when I push on this side of the abdomen, I'm looking at the opposite side and looking for a wave, a fluid wave, and that would indicate that he has ascites, and he doesn't, which is great. And pause. Just stop it. want to edit